Good morning and welcome back to DigiFest. I'm delighted to have so many with us. I'm Jonathan Cameron. I'm the Deputy Director and Head of Digital Health and Care in Scottish Government. And certainly a very warm welcome to those of you from around the world. I'm delighted to have so many people joining us for this really exciting event. And as we near the halfway point, I think there's already a lot that we can take on board and reflect and learn from, and really an exciting program for today as well. Maybe just wanted to start by also welcoming you to a very snowy central Scotland. And I was just reflecting on the fact that it was an added bonus that this is a virtual conference this year, as it's meant I've not had to worry about getting on a train or worrying about how to get to the conference venue as we would normally have it. Anyway, so wherever you are, very warm welcome. And just a quick introduction to myself to say that joined Scottish Government a year ago, which maybe in hindsight was perfect timing for the COVID response. But prior to that, many years in the NHS and as part of National Services Scotland, and a wide number of programmes in data and digital, and systems like the Emergency Care Summary were very much part of my world for many years. Can I start by just saying a big thank you to the organisers of DigiFest, a particular thanks to Nessa and the team in SHSC for this event. And I would really encourage everyone to keep going in the chat and and feeding back on everything that you're hearing, not just today but over the coming week as well. Our theme for today is essentials for a sustainable change, and you've already heard this morning, or I hope you were able to join the breakfast session from SCVO. And also from Debbie Proven and the wonderful work that the NMAP community have been doing, not just during COVID, but going into the future as well. And I think workforce is absolutely an essential to all of the work that we need to do in digital health and care. And it was certainly great to hear Debbie and others and all the work that's been done in that area. Before I move on, just a quick reminder, just some key housekeeping points that I've been asked to raise. So certainly would encourage everyone to visit the expo area. And certainly from myself, a massive thank you to all our sponsors and those that have taken the time to be part of the event. We really do appreciate the support. And certainly as many people as possible, if you could make time to visit the expo, that would be hugely appreciated. Immediately after the next session, we have the poster session, which starts at 12:30. So again, encourage everyone to take Q&A with each of the speakers. And also within the expo area, there's the resource library. And again, we'd really signpost as many people as possible to do that. That also is where our on-demand videos are, and certainly for those that are catching up, that'll be the best place to find both today's events, but also from those from the past week. Before I introduce the next session at 12 o'clock, I just wanted to highlight the other items on the agenda this afternoon. So we're going to be hearing from Louise Benny and the team at NHS 24. And certainly NHS 24 have played a crucial role in our response to COVID. And it was certainly great to hear that and for Louise and others to share the great work that's been done. I'd also really want to highlight the call to action that our colleagues in Digital Health and Care Innovation Centre are doing at 2 o'clock today. And again, really encourage feedback and input into that session. And again, a big thank you to Digital Health and Care Innovation Centre for the support they've given us during COVID as well. And lastly, and one that I think is really important, is our colleagues in local government digital office and in the housing sector, and it's critical that area is part of our strategy going forward, and again really looking forward to hearing about the progress that has been made in such an important area, and again really encourage everyone to stay for that event, and hoping that a Friday is a little easier for you all to make some time for all the speakers today. So ahead of the presentation, I just thought I'd share some thoughts, both around the theme, but also to take a bit of time to talk through some of the refresh for the digital health and care strategy that we're currently planning, and just to highlight some critical areas that particularly go into the theme for essentials and how we're going to sustain the change that's come, not just from COVID, but also just from all the other work that was it was in hand pre-COVID as well. And certainly our thinking behind the strategy is that our overall aims stay the same, but we need to focus and provide more detail in critical areas. And we need to start working collaboratively or continue to work collaboratively to ensure that we start meeting those aims. I also just wanted to highlight the word sustainable in this. It's important to note that 2021 Glasgow will be welcoming the world to the climate change conference. And I think as we come out of COVID, one of the next big challenges that collectively we face will be climate change. And our response to that and the role that digital health and care will have in that is really crucial. And I think the work that's been done on telemedicine and telecare has a really important role in managing or helping us to address that challenge. I think the other essential element to all of this is putting the citizen at the heart of all that we do. And I think it's great to see already in the discussion so far, and certainly in many of the items coming up next week in DigiFest, that there's that key message is there that citizens will matter for everything that we do. And I think the other reflection I would make on our COVID response, particularly, and essential for me as we move forward, is the idea of being very agile in our approach. And I've certainly picked up in the chat and some of the previous discussions the importance of giving things a try, of making a start on work, and I think accepting that things can't be perfect. But it's important that we make a start and that that we make progress. I think some of the work we've done in COVID has really demonstrated that. And I would particularly highlight the clinical safety huddle tool for care homes that was very rapidly deployed. But the work is ongoing to continue to improve and enhance that tool that's been rolled out to all care homes. And I particularly would like to highlight the role that NHS NEDs have had in really delivering that as quickly as possible in such a crucial group of citizens for all of us. I think building on that, the importance of care homes is definitely a message that will come out in the refresh of the strategy. And I know there's other parts that we will have in delivering the digital health, the digital care plan that Margaret and colleagues are leading on. Related to that, I was delighted to note the announcement of the £1 million fund as part of Connecting Scotland, and the availability of devices that will be made for those living in care homes, the residents of care homes. And for me, it's an essential that care home residents feel part of the community, and that we enable the right digital services to them. And digital inclusion has come up as well as a really interesting theme and key point. Been delighted to support the work that Connecting Scotland have done as a programme. And it's essential for me in terms of sustaining change. Today's theme that we continue to build on the work that Connecting Scotland have done, and that we continue to close the gap. And for me, it's not just about the provision of the device, but it's very much about the skills and giving people the confidence to use digital. And that comes back to the theme of agile as well, where we try and encourage as many people as possible to give it a go, and to try things. And I think we've seen that very much actually with a very successful rollout of NHS Near Me, which I'm sure has been mentioned already in the conference. But that's a great indicator of particularly how citizens have reacted to the rollout of digital and the availability of the tools that we have. I think if I shift slightly, for me, one of the other big essential areas is our underpinning infrastructure. And I just wanted to take this opportunity to highlight that we have a new enabling technology board now in place, and it's chaired by Anne Moises as the former Chief Information Officer for Scottish Government. And the importance of that is that we are going to be setting out in detail our technical architecture and technical roadmap for the infrastructure that is needed to support all of the work that we do. So that's things like the Swan network, it's things like our use of Office 365 and Teams, and it's things like understanding how systems need to integrate with each other. And it's not just within health. I think the other really important work, and we've certainly had already fantastic discussions with local government digital office, with COSLA, and with other local authority partners, the importance of starting to really move forward on the journey to integrating health and social care. And for me, that starts with the federation and the link up of the investment that we've made in Office 365 and using that, the use of Teams and the use of the tools in a way that really opens up the sharing of information and closer collaboration and working. It also will support the move for analog to digital telecare. And I won't say too much more on that, but again, would highlight that will be a key theme that will come up in the session at 3 o'clock today. And again, really welcome the input and involvement from our colleagues in those programs. And that is again a critical element to delivering on our ambitions for the digital health and care. I think the other thing that COVID has also brought home is the need to work from home. So yes, I'm at home just now, and I think as many of you will be as well. And as we come out of COVID, though, one of the interesting shifts will be the desire and potentially the need for people still to work from home. So the move for COVID has meant we've put a lot of pressure on our infrastructure to support remote working, and I certainly think that we've risen to that challenge. And as we come out of COVID, it'll be interesting to understand, right, how best do we support the workforce? And so for me, it's essential that the infrastructure and the work goes on. I think there'll be more to be said about the digital health and care strategy over the coming months, but we are making a start on it now, and certainly events like DigiFest are critical to our thinking and to our understanding. So again, I would really encourage discussion in the chat and feedback to everyone involved in the event. Another critical area for us as well as part of the strategy is citizen engagement. And our colleagues in NHS 24 in sharing the work they've done with COVID are also likely to touch on the concept of the idea of a digital front door. And one of the things we're very interested in understanding is how best do we signpost citizens into our digital services? What's the right route to take? And building on that as well, will also be short. We'll also be including our ambitions around digital appointments. And again, one of the other lessons from COVID has been that the shift to people not being able to visit the GP practice or not being able to come into to A&E, we need to be able to digitize and support that process. So many of you will be aware of the work that's underway to support the change in urgent care, and yeah, we'll certainly keep an eye out for the announcements to come. But that's another indication of the shift in thinking and the shift in the importance that digital has brought to us overall. And so many of these themes will come up, and many of these essential elements will come up as part of the digital health and care strategy refresh. And we're currently trying to publish that in March, but ahead of that, there'll be plenty of opportunity to engage and help us shape that strategy going forward. In terms of technical elements as well, we're also very interested in understanding things like digital asynchronous communication, so the idea of messaging between the citizen and the right consultant or the right person. I'm going to pause just at that moment just to hand over to Nessa. I think Nessa's got an announcement to make about our next speaker, which is perhaps a little unexpected. Nessa, are you okay?
Yeah, thank you, Jonathan. I just have to give apologies. It's been a slightly stressful morning, early morning start for our keynote speaker in the United States, and obviously complications for Jonathan too. So we had hoped to have Anne Mon Johnson, the Chief Executive Officer of the American Telemedicine Association, joining us live this morning, but we've run into some technical audio issues that we cannot resolve in time. So what we're going to do, everybody, is Anne is going to record her presentation, and we'll aim to have Anne join us early next week. We'll put it in the program and let you know. In the meantime, Jonathan, I just want to let everybody know that we are going to play the keynote presentation from the very start of DigiFest. So you'll be hearing from Tessa Lind Goodson, who's the Head of Innovation at the Center for Innovative Medical Technologies in Denmark. It was an excellent keynote, and I hope you will enjoy it if you haven't had an opportunity to hear it previously. So we will have Anne, but we won't have her this morning. Just back to you to say thank you, Jonathan, and then we'll hand over to our recording of Tessa's presentation.
Sure, thanks for that, Nessa. Just that's a real shame. I had been looking forward to this, but that's one of those things. I'll just finish by saying there'll be a lot more to share on the strategy as part of the discussion on Wednesday, when we'll be joined by Colin Cook and colleagues to talk about the AI strategy and the digital strategy, as well as digital health and care strategy. And just to say thank you to everyone once again for all the input and for taking the time. It's a real shame, but certainly I'll be catching up on Anne's presentation soon. So Nessa, I'll hand back to yourself, and thanks very much once again.